what you're seeing here is the inside of the cranium, the base of the skull from the inside. This is the middle cranial fossa, this is the anterior cranial fossa and the posterior cranial fossa. These are the lesser wing of sphenoids, and this is the superior border of the petrous temporal. So this area here is the posterior cranial fossa, and which is covered by tentorium cerebelli. This is foramen magnum. Anterolateral to foramen magnum, there you find is a jugular foramen. Now, this jugular foramen is a false foramen because it's not within a single bone. It is formed between the occipital bone and the petrous portion of the temporal bone. Petrous temporal is superolateral and occipital is infromedial. Then between this jugular foramen and foramen magnum, there you find, actually on the outside you find is the occipital condyles, but on the inner surface here you find elevation here, and that is called jugular tubercle. This is jugular tubercle. Then this foramen is in fact a big foramen. It's divided into three parts. Here you find is jugular notch for the inferior ganglion of the glossopharyngeal nerve. Here is a notch. Still it has a fossa here, depression here. This is called jugular fossa, which lodges the bulb of internal jugular vein. And these transverse sinus, which continues as sigmoid sinus here. This is sigmoid sinus, which drain out here, or rather sigmoid sinus continue as internal jugular outside the cranium. And there you find is a depression here because it's this inferior petrosal sinus, which also drains out through this foramen and reaches down to terminate their drain into the internal jugular vein. And through this foramen, there will be three cranial nerves that will emerge out. You know that 9th, 10th, and 11th nerves will emerge out through the middle portion of this jugular foramen. Apart from that, there will be meningeal nerves, meningeal vessels, emissary veins also passing out this jugular foramen. So you have some idea of this foramen, and remember that it's actually here the medulla is located, pons is located here, midbrain is located here, right? It's the upper half of the midbrain which emerges out of the anterior notch of the tentorium cerebelli. So the course of glossopharyngeal will be from here reaching up to this portion. So while it traverses from this area over the clivus laterally to reach the jugular foramen, it actually grooves. So this glossopharyngeal nerve will groove this jugular tubercle to reach the jugular foramen. Where you're seeing is an outside here, it is this foramen magnum. Can you see now this is the occipital bone, and this much is the petrous temporal bone, and this is the basic occiput, and the pharyngeal tubercle here. You know, the highest limit of the pharynx reaches to this point, and you have pharyngo-basilar fascia attached on the right sides. Then these are the occipital condyles, and these are the jugular foramens between the petrous and occipital bone, and it is just here laterally you will find is, you know, between this jugular tubercle on inside, you find is rectus capitis lateralis attached. Okay, so if you've seen it from the outside view as well, and this is from the inside, again they have tried to show this is the jugular foramen. Can you appreciate there is this opening here also, and this opening is the internal acoustic meatus. Remember, three nerves: facial nerve, nervus intermedius, and the 8th cranial nerve into this. Okay, now look a better view. This is foramen magnum. This inner surface of the basilar occiput is called clivus, onto which the brainstem is resting here. This is the inner surface of the occipital bone. This is the confluence of sinuses. These are the transverse sinus, which will continue as the, you can see here the impression here. This is the sigmoid sinus. Transverse sinus continues as sigmoid sinus, and it drains out through this jugular foramen and continues as internal jugular vein. They find is anterior condylar canals, which provides a passage for the hypoglossal nerve. Jugular foramen here you see is this notch, the glossopharyngeal notch, and this is the jugular fossa. The bigger one posteriorly is the jugular. So can you see this orientation? Because you know there is a diagram. Will you be able to identify to which side is this jugular foramen belongs? So make sure that the inner surface is convex and the notching is present on the superolateral surface. Okay, this is another view. You can see the structures emerging. This is internal acoustic meatus on the posterior surface of petrous temporal. Here you find is jugular foramen. Can you see this is inferior petrosal sinus in the anterior portion? In the posterior portion, it is the jugular vein, internal jugular, and in the middle portion, the three cranial nerves and the meningeal vessels, as well as the pharyngeal nerves, and the emissary veins also. They all will be passing and traversing through this jugular foramen. Another view here you can see is the tributaries and the communications of the cavernous sinus present on either side of the cellular trachea. Here you can see how the superior and inferior ophthalmic veins are communicating, and how this, you know, intercavernous sinuses, anterior and posterior sinuses. Then this is the basilar plexus, There you find the superior petrosal communicating sigmoid sinus. There is this inferior petrosal sinus, which emerges through this jugular foramen. And one more thing is this inferior petrosal, it actually separates. There were three nerves in this jugular foramen, 9th, 10th, and 11th. So this 9th nerve is separated from the 10th and 11th nerve because of inferior petrosal sinus. Remember that. And then there is a dilatation here called jugular bulb, and this portion of the jugular foramen is called jugular fossa. Then here you finding is this plexus, which is running down right into the vertebral canal. So internal vertebral venous plexus communicates with the basilar occipital plexus, basilar plexus within the cranium. So there's a communication down into the vertebral canal as well with the internal vertebral venous plexus. Okay. Then, this has to be studied in detail because there are fine canaliculi associated with this jugular foramen. Look here, try to, listen carefully. This foramen is foramen magnum. Then these are the condyles. Then you have anterior condylar canal and a posterior condylar canal, right? And this is the occipital bone, and this one is the petrous bone, and there is a mastoid bone, right? And this is a tympanic plate forming, the postero-inferior border of the external auditory meatus, tympanic plate. And there is a mandibular fossa for the head of the mandible, right? So here is this sphenoid with the spine of sphenoid, foramen spinosum, foramen ovale. Then you have the scaphoid fossa. Okay, look here now. Basically, you have to concentrate about this. This is the jugular foramen. It's a false foramen. On the undersurface of petrous, here you find is the carotid canal on the lower end. So you're seeing the outside of the skull from the base, inferior view. This jugular foramen has, three parts: the anterior part, the middle portion here, opposite to the glossopharyngeal notch, and then you have the jugular fossa, a depression here. This jugular fossa lodges the bulb of the internal jugular vein. Now look here, in this jugular fossa, on the lateral wall, there is a minute canaliculus called mastoid canaliculus. Very important. This mastoid canaliculus is also called Arnold's canaliculus, Arnold's canal. So vagus, it gives its auricular branch. Remember, facial nerve, tibial auricular branch, general somatic afferent. Similarly, vagus also have this general somatic afferent branch, the auricular branch. So that auricular branch of vagus will pass here from the mastoid canaliculus, right? And this, when it enters the petrous temporal, it will cross the facial canal, facial nerve canal. Remember, that was crossing posteriorly to the middle ear cavity. So it will cross the facial canal within the petrous temporal and will emerge out here. It will emerge out here between the tympanic and the mastoid bone. So this is tympanomastoid fissure. So this branch, auricular branch of vagus, which is also called Arnold's nerve, and it's also called as Elderman's nerve. That nerve passes within this petrous temporal, crosses the facial nerve, emerges on the surface of the skull between the tympanic plate and the mastoid. That is called tympanomastoid fissure. And of course, here it will be the pinna attached. So it will innervate the basal portion of the pinna, or the attached portion of the pinna, as well as the periphery of this external auditory meatus, as well as the floor of the external auditory meatus. Again, the sensations brought will be general somatic afferent. So remember, the importance of this is that one thing is that it has two names. This auricular branch of vagus is also called Arnold's nerve and also called as Elderman's nerve. Okay, so that's the course of this auricular branch of vagus. And for that, you have this mastoid canaliculus in the jugular fossa laterally. Then there is another canaliculus called tympanic canaliculus. Tympanic canaliculus, you will find here, actually there's a small thinned out crest between, you're seeing from the inferior view, right? So you're finding is the carotid canal, and this is the jugular fossa. So in between the jugular fossa and the carotid canal, there is a thin plate of bone, and onto that thin plate of bone, you will find there is this canal, and that's called tympanic canaliculus. Through this tympanic canaliculus, it is the tympanic branch of glossopharyngeal nerve. So it's the first branch of glossopharyngeal, right? And that arises from the inferior ganglion of the glossopharyngeal nerve. So tympanic branch of glossopharyngeal essence, and it passes through the tympanic canaliculus, and from here it will reach into the middle ear cavity. And within the middle ear cavity, it will form a plexus over the promontory, and that's called tympanic plexus. And in this middle ear cavity, there's all mucosa lining the middle ear cavity, and that will be communicating anteriorly to the auditory tube, and posteriorly it will be communicating to the additus to the mastoid antrum, and the ear cells. So all of this surface of the middle ear will be innervated by this nerve, tympanic branch of glossopharyngeal nerve. And don't forget that this nerve is also carrying preganglionic parasympathetic fibers, which will have nothing to do here, rather they will extend as lesser petrosal nerve, and they'll emerge out of this petrous temporal bone in the form of hiatus for the lesser petrosal nerve on the anterior surface, and will pass out through foramen ovale. And remember that this nerve also has a different name, that the tympanic branch of glossopharyngeal nerve is called Jacobson's nerve. So these are some named nerves. You need to remember them. Jacobson's nerve is the tympanic branch of glossopharyngeal nerve. Alderman's nerve or Arnold's nerve is the auricular branch of vagus. Both of them, they are entering to their destinations from this jugular foramen. They have one more canaliculus they have not shown here, and that, look here, this middle portion of the jugular foramen, here you find is the glossopharyngeal notch, right, the middle portion. So glossopharyngeal nerve will be emerging out from here, and there's this notching here. To this notch, it will be, because it's from the outside, the inferior glossopharyngeal ganglion will be. Because of that, in fact, there's a depression here because of the inferior ganglion of the glossopharyngeal nerve. Now, when this nerve is descending down here on the medial surface, here between, glossopharyngeal nerve and this glossopharyngeal groove on this petrous temporal, there will be small canaliculus. The groove for glossopharyngeal nerve, below to that, or the undersurface of the groove, you find is a small canaliculus, and that is called cochlear canaliculus. Cochlear canaliculus will be communicating with the internal ear. And internal ear, you must have been taught, there's a bony labyrinth, then there's a membranous labyrinth, then you have membranous labyrinth of the utricle and saccule, right? So both those ductus from these two portions of the internal ear, they communicate and they form a ductus endolymphaticus, and that ductus endolymphaticus will emerge out and then form a dilatation called saccule, right? So that cochlear canaliculus, which is found in the glossopharyngeal groove or this petrous temporal, and which communicates with the internal ear, and from there the perilymph will, communicate with the subarachnoid space, as well as there will be a venous drainage of the internal ear, also a vein which communicates from the internal ear outside to drain into the internal jugular vein. So the cochlear canaliculus here in this jugular foramen, that has two communications. One is with the perilymph to the subarachnoid space, and also provides communication from the venous drainage of internal ear into the internal jugular vein. So there are three small minute canaliculus present within the jugular foramen: cochlear canaliculus, tympanic canaliculus, and mastoid canaliculus. Okay, just see here, this foramen also between the mastoid and styloid process is this stylomastoid foramen, and this provides passage for the facial nerve. When I was teaching the clinical anatomy of facial nerve, I told you that in a newborn, at the time of, difficult labor or, difficult delivery, while, handling the head of the fetus, there are chances that the obstetrician handles this fetus with the head, and there are chances when you place your finger behind the ear, you are actually keeping your finger here in the neonate, and in the neonate you don't have a mastoid process. I've been telling you that mastoid process, it develops around second year of life, right? So because it is not there, the mastoid process is not there, so this stylomastoid foramen is on the surface. So at the time of birth, if you are handling the head of the baby while pressing behind the ear, there are very much chances of Bell's paralysis, compression of the facial nerve at the stylomastoid foramen, and that will lead to lower motor paralysis. But in a neonate, how will this clinically tested? Because this neonate will not be able to suckle the milk properly because of the paralysis of buccinator. Got it? So that was compression of the facial nerve in a neonate. Another thing is, like, same thing is happening because of here, this Arnold's nerve passing here from the mastoid canaliculus within the petrous, then emerging out here between the tympanomastoid fissure. So while, pulling this head of the fetus or the neonate, if you press the finger here behind the ear, there are chances that you might compress upon the Arnold's nerve, right? Arnold's nerve can be threatening because it's vagus. It can cause bradycardia at the same time, remember. So these are some important points regarding to this Arnold's nerve. Now look here, the structures passing through this jugular foramen. Can you tell me that this is a jugular foramen of which side, right side or left side? When you are seeing it from a superior view, like, the interior of the cranium from above. So this jugular foramen will be of right side or left side? This will be of the left side, right? There's a smooth margin because the smooth margin is inframedially because of the occipital bone. This is anterolatally because of the petrous temporal bone, right? So this is the jugular foramen. Can you see it has an anterior portion, a bigger posterior portion? This is called jugular fossa here, and the middle portion. So in the middle portion, there are three nerves that pass out, and these are the 9th, 10th, and 11th cranial nerves. And one more thing, can you see here that glossopharyngeal will be enclosed separately in a separate dural sheath, while 11th and 12th will be enclosed together in a common dural sheath. Okay. Then there's this notching here. I told you that's the glossopharyngeal notch here on the petrous side of this foramen, and this lodges the inferior ganglion of the glossopharyngeal. Now, remember the brainstem was here, foramen magnum was here. So glossopharyngeal was having this course running up forward laterally. So when it runs forward laterally, this glossopharyngeal, now I told you, it passes through the jugular tubercle of the occipital bone, and grooving this tubercle, you will have an impression on this jugular tubercle, and that will be because of the glossopharyngeal nerve. Then other structures is like, this is inferior petrosal sinus, right, communicating the cavernous sinus here. This sinus, it drains into the internal jugular vein. So this inferior petrosal sinus, it passes like this, and it runs between the glossopharyngeal and the two nerves, 10th and 11th. So inferior petrosal sinus is sinus which separates these, and that's why you can say you have separate dural sheath for glossopharyngeal, because of the inferior petrosal sinus. It runs like this, passing between 9th and 10th nerve, and drains down into the internal jugular vein. Then here it's this dilatation because of the bulb, sigmoid sinus, which continues the bulb of the internal jugular. There are two meningeal arteries. Blood supply of dura, I have taught you there were two meningeal arteries which enter into the cranium. So anteriorly it will be the meningeal branch of ascending pharyngeal artery, and in the posterior portion it will be the meningeal branch of occipital artery that enters the cranium. Okay. Here also you can see that the glossopharyngeal has a separate dural sheath. 10th and 11th have a separate dural sheath. Then apart from three nerves, dural venous sinuses, the two sinuses, two meningeal arteries, ascending pharyngeal from ascending pharyngeal, branch from occipital. And now look here, additional point is that two emissary veins also you will find in the posterior portion of this jugular foramen. Now look here, in and out of jugular foramen. Arrows also, there might be very refined type of questions, like they might list all the structures and they may ask which structure emerges out, which structure enters in through the jugular foramen. So what are the structures passing out? Let's see that you have two dural sinuses, you have inferior petrosal sinus draining out, and you have a sigmoid sinus posteriorly draining out from the jugular foramen. And what was going out was the three cranial nerves, 9th, 10th, and 11th cranial nerves from the middle portion, they were going out. By the way, this diagram is of right side or left side. If you're seeing it from the inside of the cranium, the superior view, this will be of the right side. You have seen here, it's rosteromedial and it is caudolateral. That's how it is found in the cranium from the inside view. Okay, so the three nerves and the two dural finuses, they were all emerging out. Now, what are the structures which are coming inside from outside? So these were the two meningeal arteries I told you, right? Meningeal branches from the ascending pharyngeal and meningeal branch from occipital from the posterior portion. And don't forget one other structure here. It's a meningeal branch of vagus nerve. The nerve supply of dura in the posterior cranial fossa was not only by the cervical nerves but also from the cranial nerve, especially from the vagus. So you have a meningeal branch of vagus nerve also which enters here. And in this, they have not shown are the two emissary veins also found here. Emissary veins actually don't have a fixed direction. They are like a communicating channel for the dural venous sinus to the veins outside the skull. Okay.